Welcome back to First Coast Living, folks. Out here at UF Health Proton Therapy Institute, and I'm joined by Dr. Brad Hoppy. I appreciate your time, sir.
Yeah, no, thanks for taking time to come out.
We come out here and we talk to you guys because unfortunately I know more about cancer than I ever wanted to know, and a lot of our viewers do as well, but we want to keep people informed, and today we're talking about lung cancer and the different types and the types of treatment you do here at Proton Therapy.
Yeah, sure. So there are two types of lung cancer we generally see. There's one that's called small cell lung cancer, and then the more common one, which is non-small cell lung cancer. Regardless, both types are generally due to smoking in about 90% of the cases.
And once you have that unfortunate diagnosis and that's been made, how on your end, try to understand how do you guys decide on the radiation plan and how that's going to work for the patient?
Sure. So we utilize radiation in all 4 stages of lung cancer. In stage 1 lung cancer, for patients that aren't eligible for surgery, we generally use radiation over a 1-week treatment course. It's pretty minimally invasive and patients don't generally have many side effects. It's all done as an outpatient. And then for patients with stage 2 and 3 lung cancer who aren't getting surgery, we generally use a treatment approach using chemotherapy and radiation together, but this is a bit more of an aggressive regimen. It's got more side effects and it's over a 7-week period of time with side effects including breathing problems and swallowing problems.
Which is what we constantly hear, and you guys tell us that early detection is the biggest key to helping these and getting ahead of it. And with that, the therapy, the patients going through proton therapy here, lung cancer, it seems obvious to me there's a lot of important organs around the lungs. So proton therapy being less invasive, is that why it's better for lung cancer?
Yeah. So with standard conventional radiation, it uses X-rays, and X-rays are just packets of energy that go right through you. With protons, they have both mass and charge, so they'll go a certain distance and then stop. And so, as you said, because we're in the chest area, we can limit the radiation dose to the lungs, to the heart.
I know you're busy, so I'll walk and talk with you here so you can get about your day. So is proton therapy used for all lung cancers? Can it be used for all?
Yes, it can be used for most lung cancers. Patients with stage 2 and 3 lung cancer is probably where we see the biggest benefit because we can reduce some of those real significant side effects.
What kind of clinical trials are there for lung cancer?
Yeah, so what's pretty exciting here is that we're working on ways to reduce the length of treatment from a 7-week treatment approach to a 3-week treatment approach, which may actually also improve the efficacy of the treatment.
Right. So if anyone out there that's watching right now has unfortunately been diagnosed with lung cancer or has a loved one that has, how would they know that proton therapy would be right for them?
Yeah, so there's no great way. The best way, though, is to contact the University of Florida Health Proton Therapy Institute, and a physician like myself will review the case to see if we think there's going to be a good benefit for you using proton therapy.
Well, I know you're busy, Doc. I really appreciate your time, and I really
appreciate
this, information for our viewers. So I'll see you soon.
All right, thanks.
We got more coming up on First Coast Living. Really appreciate UF Proton Therapy Institute and UF Health for making this happen. More coming up on First Coast Living. Be right back.